Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a 9-year-old female lab with right hind lameness. I'd like to use this case as a way to talk about the radiographic joint space. When we refer to the radiographic joint space, we're talking about the radiolucent region between two bones at a joint. This region can contain synovial fluid as well as soft tissue structures. We are unable on radiographs to differentiate soft tissue structures within the joint. In the case of the stifle joint, this could include the menisci at the medial and lateral aspects of the tibia, as well as the cruciate ligaments, the joint capsule, and any periarticular ligaments, such as collateral ligaments, or even the patellar tendon. Those all have the same opacity as the synovial fluid. This results in the radiographic joint space having structures which we know are in there and in many cases are really important, but we can't really see them. The other thing that's in the radiographic joint space, coating the ends of arthroidal joints, is articular cartilage. So what I'm tracing now with the thumb is the subchondral bone margin. But next to that, and within the radiographic joint space, is the cartilage surface. So when we think about joints on radiographs, I'd like us to remember that there's important structures in there which we're not able to see within the radiographic joint space. In this case, I see increased volume in the radiographic joint space. I'm noting this on the lateral view because the infrapatellar fat pad, which is this lucent region here, is somewhat cranially displaced and slightly less prominent than normal, and there's increased fluid or soft tissue opacity within the joint here, as well as here at the caudal joint pouch. This is evidenced by slight distension or displacement and a mild loss of conspicuity of the very subtle fascial plane at the back of the stifle joint created by the gastrocnemius. When I look at this joint on the CC view, within the radiographic joint space, I'm concerned that there's a feature here in the intercondylar region of the tibia, somewhat sharply margined. This is an important area in dogs because this is the area of the cruciate ligament insertions. One other finding on this case that I'll note is there is a large area of periarticular new bone formation here on the lateral aspect of the tibial condyle. My overall impression otherwise is that there aren't very many periarticular changes in this particular stifle. So I would conclude in this case that there's a moderate increase in synovial volume, which could be due to synovial effusion or, for example, capsular thickening. We're not able to differentiate the cause from radiographs because all of these structures have the same opacity. I would also be concerned that there could be an acute injury to the cranial cruciate ligament insertion and that there are some signs of chronic instability, such as this osteophyte here. So we would then need to take the radiograph and go back to the patient and do a thorough orthopedic examination. A cranial drawer sign would be a good test to determine if cranial cruciate ligament insufficiency could be present. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post any questions on social media.